One thing that is paramount in your role is being one that champions safety in our clinics. Safety is an important issue when it comes to physical therapy. Many of our patients are older. They have changes in their vision. They have changes in the sensations in their feet. They have changes in their inner ear and their equilibrium system. They have changes in their ability for their muscles to react to changes in their environment. All of these factors can impact balance and lead to higher likelihood of falls. This is something we hope to completely prevent in our clinics, and it's something that we know is completely possible with your help. With many eyes in our clinic, we should never have anybody that is outside of our attention. That doesn't mean we have one-on-one attention on every single person all the time, but in particular, that we are making sure that while patients are transferring from a seated position to a standing position, from a table sitting up and then coming to a standing position, or transferring off of an exercise or machine, that we are there just in case. Even with our most active patients who don't appear to have any issues with their balance, it is best practice to make sure we stand by for their first couple of steps, just in case something were to happen. I even find myself doing this with our younger patients who are athletes, and sometimes they make a remark as if, I'm okay, I don't need this. But that's okay. We ask that you do this with each patient so that way we can ensure their safety. There's nothing more important to us than our patients and their safety. These are dear people that have trusted us with their health, and we hope that we can be equal to that trust. In addition, we're also aware of lots of liability that we take on as the providers. And as the providers, we have the sure responsibility to make sure that we are keeping our patients safe. And you are an extension of us in that labor. As we work together, we can make sure that patients are safely participating in their programs while in the clinic. This takes a little extra concerted effort on our part to make sure that for every patient who is changing positions, that we are there attentively watching and ready to support when they come up from a table or a chair and begin standing and taking their first few steps. What takes a few extra seconds of our time makes a huge impact. We also ask that you be able to look at the patient's flow sheet, that you might be able to better understand those who are at higher risk of falling. We will cover this later when we talk about the flow sheet and the purpose of the flow sheet, as well as when we talk about things called contact guard assist and standby assist in future videos. But for now, it's important to understand that there are patients who will be at a higher risk of falling than others, and these receive extra priority. Anytime they're standing and moving throughout our clinic, they should have somebody right next to them ensuring their safety. This again is so important to us. We treasure these patients who come in and their health and the trust that they've given us. We do not want to lose that trust from them or their families. We also seek to make sure that we are creating a safe environment for all, both our staff and our patients. You are a huge part in helping us do this, and we so appreciate your efforts in this. Thank you for your attention to detail and your willingness to learn. If you have any questions about safety and how you can help us maintain safety within the clinic, please ask. We are happy to help.